Once the cooling cycle is complete, platelet-rich plasma has been successfully transformed into platelet-rich fibrin using the Juventix Plasma Bio Incubator. The sample will now appear opaque in clarity and lighter in color. Carefully remove the syringes containing the platelet-rich fibrin from the Plasma Bio Incubator. Once removed from the Plasma Bio Incubator, you will attach an appropriate needle or cannula to the syringe to apply the platelet-rich fibrin matrix gel to the anatomy of the patient for the intended procedure. To demonstrate the flowability of platelet-rich fibrin, I'm going to attach various needle sizes to show how easy the finished product will actually push. A little tip as well, after incubation, you can form a mild clot in the lower tip of the syringe where it's smaller. So first push that little clot out of the tip before attaching your needle or cannula that you wish to flow through. You can go in with the smallest size, which is a 30 gauge needle. Very small needle, the size used for diabetic injections. You're still going to be able to easily flow this product through a 30 gauge needle, as you can see here. And flowing through a 30 gauge needle is not going to degrade the structure of the platelet-rich fibrin matrix gel. You're going to see that it maintains its structure. And if we go from a little higher up here, you can see the flowability and how it maintains that structure. So this is passing through a 30 gauge needle, very, very, very small needle. Now we're going to demonstrate flowing through a 27 gauge needle. 27 gauge needles are great for use in facial aesthetics because the needle will have some bend to it and can work on curved structures such as the pre-jaw area. It is a favorite. Oh, clear the clot. Clear the clot right there. Now attach your needle. So here we have a 27 gauge, 1.5 inch needle. Flows even easier than in the 30, maintains the molecular weight and clarity of the sample even a little bit more than in your 30. So there's your 27 gauge. I'm going to leave the 30 gauge here so that everybody has a point of reference to see which was used for which. And now let's say you're using this for an orthopedic application. Let's pass it through a much larger needle. We're going to use a 21 gauge 2-inch needle here. Needle typically suitable for injections into anatomy such as medium and large joints, knee, shoulder, things of that nature. With our 21 gauge, it flows super easy, no resistance whatsoever. You can see it maintains that matrix even more so than in the other applications. And then so that you have a comparative point, I'm just going to show without passing it through a needle, the full processed platelet-rich fibrin matrix without a needle or cannula, so that you can see the density of the sample. So it's a nice dense sample with an excellent cellular matrix. This is going to create a great substrate and scaffolding for the formation of new soft tissue at the area of injection site. Again, to review, we've gone through a 30 gauge, 27 gauge, this is a 30 gauge 1 inch, 27 gauge 1.5 inch, 21 gauge 2 inch, and then no needle whatsoever, so you can see the consistency of the sample that comes through. To take this back to aesthetic applications, if you're doing lips and fine areas, small needle is going to be most appropriate. If you're doing moderately sized areas, such as the pre-jaw area, nasolabial folds, 27 gauge is going to be appropriate. And then here we've got your orthopedic application. And without a needle, this is how you would apply it to the defect of a wound bed, such as a non-healing diabetic ulcerative wound, a pressure ulcer, or a venous insufficiency ulcer. And that completes the process of bioincubation from platelet-rich plasma to platelet-rich fibrin matrix gel.